very good afternoon to all our audiences who have joined us on the auspicious occasion of World Autism Day. Today we have with us Mrs. Aaktriti Wadhwa, who's a clinical psychologist at the Mind Veda. She is a licensed clinical psychologist and an MPhil in clinical psychology, experienced over 5 years in a wide range of clinical and therapeutic environment, having specialized in providing intervention services for individuals. She has also catered to their developmental and mental health issues. Her approach is clinical work collaborates between theories such as emotional focus therapies, counseling techniques such as CBT, REBT, personal centered, and psychodynamic therapy. That's quite a nice work which Akriti is doing at the Mind Veda. We are really delighted to have you here on the occasion of World Autism Day, Akriti. Please tell our audiences a little more about your interesting profile.
Okay, so first I'll talk about the organization. So at my we have a team of psychologists, clinical psychologists, and psychiatrists, and
Right,
we cater with mental health issues at a very minimum cost. So our main motto is to help and provide mental health services to one and all individual present that we can reach out to. So it's not about
right,
the costing. Like, when you say that I want a therapy session, and people usually say that it's a higher cost, it's a very
right,
expensive thing. So we try to cater that at a very, very minimum cost for everyone, and help them to provide with all the therapeutic interventions.
right. What remains your
So,
consultation fees at Mind Veda,
so it
Akriti?
really depends. That is something you can come up and then we can discuss with. Okay,
Okay,
and it's an establishment present in Old Rajendra Nagar. So one
okay.
can visit, one can easily either do it online. So that totally depends. We can have sessions.
Right. Okay, all right. All right. And what is your call on, on the term autism spectrum disorder? I
So
mean, our audiences are keen. I'll just tell you something about our organization. So, at
okay,
Shaurya Foundation Trust, we cater with all intellectual disabilities, where the maximum number of population that of young adults that we have falls under the category of autism spectrum disorder. So it is a very big day for us, and we have
yeah.
been running a lot of campaigns. Wear Blue for Autism, Wear Blue on April 2, and support Shaurya Foundation. So Shaurya Foundation has been working in terms of making neurodiversity and turning it into entrepreneurship. So we try to get the best out of the individual and support them in their entrepreneurship journey in terms of art, music, bakery, and we have a wide range of curriculum for each individual and their unique talents.
Yeah.
So
That is
that's
something
pretty much
really
that
nice
we
to
do
get to
at
know.
Shaurya Foundation Trust. Yes, indeed.
Yeah, making
So
individuals.
exactly. One second. Yes. I would want you to elaborate to our audiences more about the autism spectrum disorder.
Sure. So, as we know, like today's World Autism Day, right? Having a day to something means we need to get the population, get the other individuals know about it.
Right.
So,
Right.
right, everyone has a lot of myths around autism. Okay, a lot. If a child is not able to do anything, my child is autistic. How can, like, especially in Indian society, all we get to know, like, a lot of parents come and, like, that's not my child. How can this happen to my child? Right? That is the
Right.
first reaction that we get of an Indian parent. Like, nothing is wrong. मैडम अब देख लो कुछ कुछ थोड़ा सा होएगा वो हम थोड़ा सा हेल्प कर लेंगे हो जाएगा but that acceptance part that
Mm-hmm.
something is happening
Right.
We need to make them aware that something is happening at the right stage, and you need to help the child and get the right help at the right pace. So,
Right.
if you are in denial that nothing is happening to my child, nothing is wrong, then sometimes that leads to a lot of delays, you know
That's true.
and
That's
then
true.
you let the child see. In Indian society, we have rules saying that you can't fail a child until third grade, right? Especially in government school. So you let the child pass in the other classes, other domains, and they're doing things. And then the
Mm-hmm.
parents get into, okay, the child is doing well in academics, even if the child is not. And then somehow or the other, by the age of when the child is 9, 10, somewhere they get into adolescence, and then what it creates a problem. Now what to do? Because we couldn't detect it at a very early stage. And we go
Right.
like autism spectrum disorder. So it's a spectrum of disorders. Autism is a part of it. So there are
Right.
other various disorders coming with it, like Rett
Mm-hmm.
and other disorders. So there are other disorders that are usually defined in a clinical terms to understand what it is. But when we talk about just autism, then we'll be talking about three things that would be the main things that we would be looking upon. That is, first of all, when an individual is suffering from, or say, suffering from, autism, that would be a very difficult term, and we won't be using that. Say the individual has autism or
Having the
is
condition. Right. Right.
has
Right.
a condition. So you're not
Right.
like, autism is something that does not have a defined thing that why the child is autistic. So it does not, like,
Right.
there are certain genetic conditions where we can say it's present, right? But not for all individuals. We know the reason where the autism is starting.
Right.
It's just
Right.
a
Right.
condition that comes into development disability. That's what we say in our general terms. So when we say the child has a lot of difficulties in social communication, that is the first
Mm-hmm.
part, and interaction. Second would be restricted behaviors and repetitive behaviors that the child would be facing. So these are the two main things that would be when we see these things that we say that the child might be having autism. So how do we
Okay.
see that, these are the two conditions. I just told you the two, social communication and a restricted and repetitive behavior. So there are various
Right.
things listed under it in a
Of course.
general.
Of course. It's a whole
Okay.
spectrum, indeed.
Yeah. So there's like whole spectrum on these, but these are the two main things that we say that leads to that. So
Mm-hmm.
as we know, the children have a little difficulty in their behavior, a little
Mm-hmm.
difficulty in communicating with other people, having
Right.
certain interest at a certain age, like when we're children, we like to start playing with things, start like having friends, start making new friends,
Right.
like when we go
Right.
to nursery, kindergartens. But these children just face a little difficulty towards having that interaction, getting to know other people, not able to
Of
deal with other
course.
people in the situation.
Right.
They don't know what a social smile is. They don't know what to sit and talk to other people with. So little lack
Right.
of judgment is present over there. So we need to
Right.
help those children with it. And
Mm-hmm.
also, they have difficulties in communicating. That is verbal communication that we can say. Like, for example,
Right.
you understand what I'm saying, right? These
Mm-hmm.
children do not understand what we're saying, not because of the vocabulary,
Right.
not because they're not taught
Correct.
English or Hindi or a mother tongue, they have it. Just they're
Right.
not able to process what the sentence is. So even the smallest
Of
sentence,
course.
say like I'm Aaktriti. Okay, I just
Mm-hmm.
introduced myself. Sometimes they
Right.
might take 3-4 seconds to process what is happening. Who's that other person? What did they say?
Right. Right.
Right?
Right. Right.
And then they might just take a little more time to understand them telling them, come here, give me this. Certain examples
Right.
that when we
Of
work with
course. Of
children.
course.
Okay?
So,
For
what are the different ways in which we can communicate?
I what are the
What
different
are
ways
the different unique ways in which we can communicate to a
with the
person?
children?
Yes. Yes.
Yeah. So there are different therapies that we start with that I hadn't gotten to the part yet. So before I was getting to therapies, there are different ways that we help the children with when they're diagnosed at the right age. Okay. So
Right.
usually, have you heard about the developmental milestones that an individual faces? Like by the age of 1, we start crawling, start seeing people around, having a social smile. So these are the general developmental milestones that a parent needs to take care of. Okay,
Okay.
the child is not meeting these developmental milestones by the age of like
Mm-hmm.
easily available on internet or easily available when we say the child should start speaking the first word by 1.5 year. Certain things that we say that there. So if these
Right.
developmental milestones are not met, for example, like
Right.
certain delays are always present. Sometimes one or two domains is still okay. But if a child is
Mm-hmm.
facing difficulty in all the domains and they're not able to see it, then we say
Right.
you should take the child to a psychologist, especially a trained professional, not to some other people, like, and then get to know what the different screening tests are done. So that is by
Right.
the age of somewhere till like, it can start getting detected by by 11 months. So that's at earliest when we say.
Okay, so 11 months is the earliest stage at which it can be detected. And what
Yes,
are the
yes.
some of the signs which the parents can observe? I mean, what are the symptoms and what are the signs which they can be aware of so that they can.
So, when we are very young, by the age of like when we start by 6 months, we start rolling over the bed, start crawling, starting grabbing objects in the environment, reaching out to things, passing the social smile. That is like when you play peekaboo with the child, or when you say, "Hi, how are you?" And the child goes like, "Poo, poo," making small, small
Right,
sounds,
right,
right?
right,
If all of that is not happening with the child, like, right? And the child is not able to do it. Maybe when they see others outside stranger, they're not making sounds. They start crying. They start facing. They do not understand if someone is standing right over near their face. Right? That is
right,
the time when we say that these are certain norms and things. So every like certain things that can be seen. That is what I'm saying. Developmental milestones is easily available on internet, easily for
mm-hmm.
the parent, right? So all these milestones should be achieved. And it's not like, okay, by 6 months he's not passing his most social smile, let's take to a doctor. Okay? It's not
Right,
exactly
right,
precisely like that also. But by
right,
6 months, if it's not happening, that is the time. Other domains are also not happening. That is the time
mm-hmm.
you take the child to a psychologist. You tell them these are the see, every child has a pediatrician where you take the child for the normal things. So you can discuss that with the a pediatrician also. Like, these are the things that is not happening with my child.
Right, right,
What to
right,
do about it, how to go ahead about it. So at that early stage also you can detect it. But usually we can detect autism by 2, 3 when we see the prominent features by
mm-hmm.
the age of 2 and 3. That is when the child does not speak even a single word, not even understanding, give me this, giving some objects in the environment to the parent. Okay, these are small, small various examples by the age of 2 and 3 that comes up. And then when the child is either doing things and the parents are in denial, then the child does not learn a lot of things.
Right,
They do not learn, their speech is not developed, they do not know the words, simple words, you're not able to deal with them. And then
mm-hmm.
by the age of 7, 8, somehow the parents are managing. And then comes the stage 9, 10 when the parents are like, okay, now I don't know what to do, where to go.
Ah,
That
right, right,
is the
right.
most prominent stage that is seen in Delhi, India, like the population that we see somewhere or the other with the Indian population. So this is
Right.
what like something that is making us face difficulties in this domain. That is the reason we have an autism day. That is the reason we have a specific, wear blue campaigns, everything. That this type of thing also exists. Here
Indeed.
we are here. It's not like these children are very different. They're not.
Mm-hmm.
Every child is special in their own terms. Like your foundation is helping them to be independent in their domain, right? You
Right,
are
right.
making them capable enough. So every individual learns different things, and every child also learns different things. If your child has autism, that doesn't mean that that doesn't mean that your child would not be able to deal with anything. That the child will not be able to do anything in their life, right?
Right,
That would
right,
not be
right.
able to be like, okay, my child has autism, what do I do now? Where do I go now? Right?
Mm-hmm.
So we have different foundations, we have different therapies, we have different organizations, we have different supports for them. But getting to know the right part is the major thing that we can say. getting to know the
Indeed,
right
indeed.
people, because in India, a lot of things, when a new thing comes up, then it's really tough for the parents to even know where to go.
Of course, of course. I mean, we meet parents every day, and they have had
They're
like
confused.
really traumatic stories to share about accepting the fact that their child had autism. That's where they sort of fall apart. I mean, and it's really difficult, and most of them, they even waste a lot of time just in the acceptance part. So, I
Yeah,
mean, it's
and so
really
we have
disheartening to know that. I mean, they wasted all these years in just accepting. But we cannot deny the fact that only the wearer knows where the shoe pinches.
Yes,
And
that's what I'm telling you. We can make these children, these are not special children that we say that, they can't do anything with their life. So that depends, like autism, intellectual difficulties, they have different spectrums also. Intelligence, how widely the child, what profound they are coming in, there are different
right,
severities, there are different things. So not two children with autism will come into the same spectrum, right? With
indeed,
two
indeed.
same symptoms, very prominent symptoms. And why does that happen? Because every individual is very different, right?
That's true.
Every
That's true.
that is the only thing when we say a clinical psychologist coming to a part and playing the role, that we say that two individuals are very different. For example, I'm going to turn into very layman language right now. Okay? If
Mm-hmm.
a child comes in with ABC symptom, okay, and another child comes with XYZ symptom,
Right.
not two of them will have the same things. One might have a
Ah,
social interaction thing, one might have learning difficulties. Okay,
right.
these are the things that we say that's the reason we need a screening test. There are different tools and tests available out there. There are different therapies. That is the reason every child has a different therapeutic plan. Not everyone
Ah,
has a
right.
perfect, like, we don't have a definition. Okay, if your child is autistic, we're going to do this screening test, we're going to do these
Mm-hmm.
therapies. That is not how it works. So this is something that a parent or an individual should be very aware that there are different kind of therapies and every therapy does not work on every individual. For example,
Right.
like even if I take young adults population, if I'm
Mm-hmm.
teaching a child certain thing, a child might with autism only or with intellectual difficulties
Mm-hmm.
might learn certain things certain way. But when it comes to another person, they might take an other technique. They might take an other
That's true.
form
That's true.
of doing it. So like
Yes,
for
they do perceive things very differently. I mean, yesterday only I had a very interesting incident with my student named Gopal. So I asked him, Gopal, you cannot stand here. So he just nodded his head, and then he very smartly and swiftly he brought a chair, and he sat there on the chair. So he followed the instruction that I told him. And I mean, I interacted with him was that, Gopal, you cannot stand here. So what he could understand, okay, I can not stand, but I can sit.
yeah.
So they're processing everything in a very smart manner, and they are just perceiving it differently. Apart from that, another example that I would like to share with another very interesting student of mine is that we were having lunch on the table, and then I asked him, could you please pass me the salt?
Hmm.
So a neurotypical person would generally pass the salt in real life, and but he said, yes, I can pass the salt to you.
Okay.
So it was a question, and that's to
And he
which he
answered the
answered.
question.
Yeah. So I feel that they're just neurodiverse. They're never wrong. I
That
mean,
is the
in
reason
what
I'm saying
they
we teach them how to do it. We tell them how to do it. So there are different
right,
therapies available for them. There are different ways of doing it. So the major signs and symptoms, we're going to first talk about them in brief and then we're going to come on therapy. Okay?
right.
So the certain signs and symptoms that are very prominent would be not making eye contact or avoiding eye
Mm-hmm.
contact. Okay, a
Right.
child usually, when a small child is there by the age of like somewhere 6 7 months, they start making eye
Mm-hmm.
contact. They start
Right.
looking at the other individual. When someone is giving with them interesting sound or anything, they look at someone. Okay, if not
Indeed.
reacting to them, at least they have a contact making that. That is
Right.
like something avoiding eye contact. Then by name responding, you don't respond to the name. Okay, by 9 months, you're not doing that. So when you start
Mm-hmm.
calling a child, it start recognizing their own names. Not able to recognize their own names is something like that. Facial
Right, right.
expressions is something that you can either again see with having that facial expression, not able to understand, like happy, sad, like they're not able to tell you that I'm happy. They're not able to tell you I'm sad because when the child is
Indeed.
sad, they might cry. When the child
Right,
is happy,
right.
they might make small, small sounds like babbling sounds, cuckoo noises. If you've heard a small child, like okay, they're happy if they're seeing a toy.
Yes, yes.
So
They do
these
follow all
children
the
not able.
milestones.
What?
Yeah, they do follow all the milestones, the developmental milestones from
Yeah.
babbling to crawling to, holding objects, fine motor
Yes.
skills, gross motor skills. It's
That
a
is
whole
again,
process and a
this
checklist that goes on in a parent's mind. But indeed, sadly, these checklists do not work with a child with autism.
exactly. These are the things where you see different. And these are the
Right.
social communication part where I told you when we talk about the repetitive behavior, what I'm talking
Indeed.
about as is like lining up the toys in the same manner. For
Right.
example, if they have Legos, they're making a line of it. Or they're just playing with Legos and they're doing a repeated behavior. So
Right.
they're not
Right.
able to have different kind of behavior patterns. So they're
Indeed.
like banging
I
their
think
head.
Lego works fantastically with these young adults. Building blocks and making patterns is something with which they resonate a lot. We have a
Definitely.
whole unit. We have a whole unit called the Packaging Panthers,
Hmm.
where these young adults they package things. So it's a repetitive process in terms of putting the boxes at stacking them up, putting them into big boxes, packing them up into cartons. So it's a repetitive process, and they do really good in that.
Yeah, they do. So also repeating certain words, certain sentences, certain phrases like I want, I want, I want, I want, that might go on for a very, very long period of time. We
Mm-hmm.
might be getting irritated. Why is the child saying like that? Why is my child
Right,
not saying that? So we might shout at them, be angry at them, stop saying that again and again and
right,
and that would an Indian parent or any parent would be like, if your child is repeating certain things, I've told you a million times, don't do that, don't do that. But at a certain thing, we need to tell them, we need to be there, like tell the
mm-hmm.
parent it's not a very conscious effort they're doing it. It's something they are born with, they have a difficulty in. This is not a
Indeed.
behavior pattern that they have learned something. It's just coming out and we need to help them in certain ways. So this
Right,
is one of
right,
the things
right.
doing that. Slapping hands. A lot of children have these slapping hand movements or having a
Yes, of
rocky movement.
course. And also, some of them they do harm themselves by slapping them on
Yeah,
the
that's
face
coming on
because
that.
of the sound that they. I always wonder why do they harm themselves, but then
Because they do
gradually.
not understand. So certain children are very sound sensitive.
Mm-hmm.
So what happens? Even the slightest of a scratch, hearing a small scratch noise, like imagine
Mm-hmm.
on a table and scratching with a pen, right? That
Right,
sound gets very affected in the ears, and they do not like certain noise. So they
right,
might just do this. They might put the pressure on the ear to feel that. See, they might just put this hand over here. They're seeking for the pressure not to hear the sound around. They're just doing it
right,
because they don't want to hear the sound. And the
right,
parents will be like, okay, what are you doing? Leave your hand behind, get your hand down, and the intensity of the sound keeps on increasing. Their head when someone is told not to do it and when they're like having a headache, that would be having difficulty again in hearing it. So that child might get agitated, irritated, not able to communicate that I don't want to hear the sound, or tell the parent stop making the sound, and that would
right.
come into a wrong way. If like the parent would understand in the wrong way, the child is not understanding, and the child will say, "I'm not able to tell the parent that I don't
Indeed,
hear the
indeed.
sound."
We had a very interesting incident with the hair cutting. With the barber that we have at our foundation. So the sound of the razor is so offensive for the child with autism that we actually requested the team at Philips to make razors without sound because that sound annoys them. like
Exactly.
anything. It's too much for them, and every electric product or should be neurodiverse in its approach.
Yeah.
So we have put across a lot of mails to the razor companies across the world. I mean, and we are hoping that we might find a neurodiverse razor for their hair cutting very soon.
Yes, because certain children have certain touch issues also. These are called sensory needs. So a
Right,
sensory need or a sensory diet, okay,
right,
that is also something that is very, like, these are technical terms if I say sensory issues or sensory diet. But what do I mean by it? So like sensory issues, like, certain touch that the child is not very
right,
comfortable with. So a lot of parents keep on complaining. They keep on eating a lot of things. They have things in their mouth. They keep eating the, you know, I hear they take anything and everything. They don't take all kind of foods also. So why is all that happening? That is because of their oral sensory needs, or that is
mm-hmm.
happening. The child is not able to walk properly. They are walking on tippy toes. They are not able to. They have not understood the concept. So that is why we say they have different sensory. So that
Right,
a sensory diet is something that the child needs to be looked upon. What kind of need does your child have? Right? What kind of need is the child looking for? Do we go for
mm-hmm.
oral? Do we go for proprioceptive, vestibular behaviors where the hand flapping, body movements, cross movement comes up to? So that's why when I say there's a therapeutic plan for everyone, but that
Mm-hmm.
therapeutic plan depends upon the child also. That depends
Right,
on, so there's a whole team of different people: occupational therapists, speech therapists, clinical psychologists. So if I would just brief you what who does what. So speech therapists, as we know, refers to speech part. They work with only totalities of speech while the child is able to do it.
mm-hmm.
Occupational therapists work with their vestibular needs, making their hand flapping behaviors, making their walking, having these all sensory things. They're not able to touch different kind of textures. Why not? Helping them with different type of textures. Every other need that you think of an occupational therapist, they would do it. Clinical
Right,
psychologists, as we say, we do with behavioral therapies. We do with other kind of, like, having telling them the daily communication needs that they can tell with the parents. At least
mm-hmm.
start expressing their toilet needs, because of a lot of things when the child is not taught at a certain age, so they don't know
Right,
how to express it, and that is when these children learn in different ways. So we need to tell them in a different way. We need to tell, so there are different forms of different therapies, behavioral therapies, ABA, which we say, if we talk about
mm-hmm.
applied behavior analysis, this is a major term that comes under autism. So usually a lot of psychologists would be referring to ABA when we talk about autism. So certain parents would be like, okay, what is this ABA? We do not
Right,
understand the meaning of ABA. Okay, a lot
right,
of this, like a psychologist, a lot of occupational therapists, they'll be like, अच्छा आप ABA करा लो, आप ABA करा लो, आप ABA करा लो. Not understanding what is, okay, ABA, is it a test, is it a therapy, what is ABA here?
right,
So that is a part of where we understand a lot of behavioral issues coming up. Okay, that
right,
is called
right,
applied behavioral analysis. It's a technique. It's something like, with depression, another technique is working. Cognitive behavior therapy. With OCD, we have like other domains coming up. With suicidal behaviors, we have DBT therapies going on. Similarly, for autistic children, we see a lot of ABA therapies working in a continuum basis. So a lot of researches have been done in this domain. A lot of things have been done in this, like, studies have been done. So that is how
right.
we concluded that these therapy work the best with the student. So of
Indeed.
course, applying them, helping them in different ways would be different for every child. I've told you that in the start.
Right.
Making a plan would be very different. But
Mm-hmm.
again, how to make that plan would be totally done with a team. It does not happen on a single, like, if you bring the child, a test will be done first. A developmental screening test would be done. That would be just a screening test to see if the child is falling under autism. Is it
Mm-hmm.
intellectual disability? Is it learning disability? What exactly are we looking at? Because when a parent
Right.
brings up a child, okay, my child does not have a, like, these are certain issues, these are certain.
Mm-hmm.
First, small brief scale is done. A screening test is
Mm-hmm.
done. just to know where it is. Okay, if it comes under autism, like I told you, autism spectrum disorder, where is it? What disorder is it? What are exactly
Right.
are we targeting? So we would do another testing. So initially, the
Mm-hmm.
two sections would be just about all the testings, screenings, testing with the parents, like questionnaires with the
Right.
parents, having activities with the children, just to know where the child is at each and every stage in their life. And then later on, we start making the therapeutic plan for them. Like if they're not able to write, if they're not able to tell their expressive needs, if they're not able to communicate their toilet needs, if they're not able to
Mm-hmm.
understand their social behavior, their hand flapping behavior, what is exactly coming upon, and then according to the therapeutic plan that we make, we follow with the child then. So this is as in like I could tell you in a very layman language, to make everyone understand. This is how the pattern goes up. Because I don't
Right.
want to
Right.
introduce the technical terms. I don't want the audience or anyone
Of
who's
course, we
audience.
have more of layman audiences here, mostly
Yeah,
parents.
yeah.
So I think the simpler we go, it's better for them to understand. Apart from that, I also wanted you to highlight some of the stereotypes that are associated with autism.
So the first stereotype would be telling the parents the acceptance. That is the certain thing that the Indian population needs to come up with, the acceptance part. Okay, that does not mean that if your child has autism or even if diagnosed with autism, that my child cannot do something. There are different schools, there are different, like, special schools for special children. We call them special for a reason because they are special, but that doesn't mean that you can just, like, tell them the child won't be able to do anything in future.
Mm-hmm.
Yes, they might not be having a proper job like some other, like on a higher intellectual level. Surely we cannot expect the child to be there like in a certain domain, like if the child is having very severe autism. Yes, we
Right.
can make them independent in their life. We can get them to a certain stage that they can have a minimum job at a minimum, like, doesn't matter about the wage, but it matters about having them independent enough that they can do their daily tasks, they can live their own life, they can have a job, small job at least, but they're making
Mm-hmm.
their life in a productive manner. They're able to communicate their needs, they're able to do their things independently. It takes over a span. You cannot. So, the second stereotype I would tell you, the child walks in, the parents walk in, okay, it's been 6 months, my child is not able to do anything. That is the
Hmm.
thing that comes up. आपने तो बोला था एक दो महीने में डिफरेंस दिखेगा, छह
Right.
महीने हो
Right.
गए हैं, कुछ नहीं हो रहा. So this is one of the thing that again we tell them, it takes time. It takes totally time. Maybe for a month the child is also getting settled in our organization with
Mm-hmm.
us, right? So small, minute differences that you can see in the first 6 months. You can't see a
Mm-hmm.
total of difference. Like if you bring a
Right.
child, like if you bring a child and you're like, okay, 6 महीने हो गए, ये ऐसे था, अब ऐसे नहीं है. So
Mm-hmm.
at least I won't say you can't see a totality of difference, but a minute difference for sure you can see that, right?
Right.
A smallest of a difference you can see, but you if you take it over a progressed layer of time, so maybe 1.5 year is where you can totally say the progress has been made in different ways,
Right.
right? That would be something, at least in year I would say. So at least in year I would say that you can see the difference in that life. So that would be something that we can make them independent over a span of time, 1.5 year, 2 years, depending upon what the child needs. Certain children may not have a lot of difficulty, right? So within span of 6 months, they might be just
Mm-hmm.
having a difficulty in a certain domain. Certain children, it's a lifelong thing, so they might take a little longer to learn the, like, where to be independent, how to be independent.
Right.
That
Right.
totally depends upon child to child. That's another
Mm-hmm.
myth. You cannot expect the child or the parent, and you cannot tell them a definite timeline.
Right. Right. Of
That
course. Of course.
I am telling you 1 year, I'm telling you 2 years, I'm telling you 3 years, totally depends upon child to child. Totally
Yes.
depends upon what the progress level is. Totally
Of
depends upon
course.
that. Okay,
Of
so
course.
another myth would be that the child would not be able to do anything in life. That is something that comes up. A child having behavioral issues, imagine the hand clapping, head banging, these behaviors are really, really high at the moment.
Mm-hmm.
These needs are really high. And the parents bring in the child. And the parents are like, okay, इसका तो कुछ हो ही नहीं सकता.
Yes, that's what the parents think that most in most cases.
Yeah, so these are certain technical, these are the things that I'm telling you, the parent would come up and say, मेरे बच्चे का तो कुछ हो ही नहीं सकता मैडम आप देख लो क्या करना. And
Yes, of
then
course, we
when
hear
they,
that too a lot.
yes, and when they do not see any progress in 1 month, because see, we take a lot of time. It's there's something they've done it over the past 3 years, right? Certain changes that we're trying to see. The parent does not notice the small differences happening. The child is
Mhm.
sitting. For example, these children are not able to sit in the proper place. So we work upon the sitting tolerance first. We are making them
Right.
able to sit at least for a minute, just a minute. The parent will
Hmm.
notice that. He will be like, अच्छा 1 मिनट तो बैठ गया ना, आपने तो बोला था कि 5-6 मिनट बैठ जाएगा. These are certain things that we need to
Right. I
take
think
care
it's
of.
all about celebrating the small wins and
Exactly.
motivating them towards the bigger picture and being patient throughout the process.
Yes, it is. So these are certain things that I would say one individual needs to take care of, cater into expressing their daily needs. So there are different ways. For example, how we teach how to express their daily needs would be there are certain cards if the child is not able to express it. Okay, these are called certain daily communicator cards. They have food, water, they have toilet, they have certain pictures of those. So at least we start giving them pictures if they're not able to do it. So the child
Mm-hmm.
starts pointing towards the picture what they want initially, and then they
Mm-hmm.
get to know what they're able to express themselves. So that's as basic as it can get at that level with children also. With young
Right.
adults, again, it totally depends if the child is not able to do it. So
Right.
that is different. Then we start telling them one words: food, water. Okay, these are certain words. If they're on an speaking stage, on if they're on verbal, if they're non-verbal, again we go
Mm-hmm.
with the cards. So that is how we bringing them from non-verbal gestures to verbal gesture. Also, it's a
Right. Right.
lot of
I
effort.
think flashcards is one amazing technique. We also use a lot of flashcards, and it has really helped us
Yeah.
in our communication process.
Because flashcard is something, see, these children are more of visual learners. For example, I would say anyone is more of a visual learner. For example,
Mm-hmm.
if I show you a picture, you won't forget that picture very easily. You would be
Of
able to
course, of
describe
course.
that picture to mean certain things. But if
Right,
I
right.
tell you certain things, your brain might just if I tell you 10 facts about certain things, your mind might just remember 1-2 facts about it. But if I show
That's
you a
true.
picture, you might have a scenery, you might associate it with something, your mind might just take like 7-8 more facts about the picture rather than when I say it verbally. So
Yes,
that
of
is the
course.
difference when how we
Visual
look at time.
learning is the most impactful indeed, indeed. No doubt about it. There are also a lot of applications that our young adults are using over the iPad in terms of communicating their words. I think
Cognitive.
one of them is Suniye, another one is Talking Tom. So these are some of the applications that they are using, which works like a Siri. So they press a button and they sort of communicate the message, and they keep those iPads with them handy in terms of communicating what they wish to say.
Yes, that would be really helpful for them. For example, a
Right,
lot of what things happen, the child is not able to say a lot of things, right? The child is
right,
not able to
right,
express a
right.
lot of things. So they
Indeed.
have certain like the iPad thing. They have certain parents. What they do, they make voice note also. So usually
Voice note.
the technique is followed outside India, not majorly in India. So you can give them a card like I am suffering from autism or I have autism. These are certain cards, and then you give one,
Right.
two, three, and then it's like okay, I need this, I need to go this way, or can you pass me the ticket for this if they're riding on bus or a train. That totally depends till the certain level they have reached. Not because
Right.
they are so I'm happy, I'm sad, because they're not able to communicate at that moment, but they're
Of
able to
course,
show
of
the other
course.
person that.
We also have an emotion wheel. It's almost like a really big circle where they just come and when they on the days where they do not feel like speaking or communicating at all, they just touch the emotion wheel. And we use that like I think we use that like 4 times in a day. They just touch what emotion is going on in their, how they are feeling, and they just touch it, and that's how we get to know. So
That's
I think
happening.
these having the appropriate AV aids can solve half of the troubles,
It does.
and it
So
works like magic. It's
it
amazing
does.
how it solves the problem. I mean, from a child who's just sitting and we are just trying to figure out what might have happened, and then they are like really really sort of their tool in terms of spreading their message across to the people around us. Apart from that, a very interesting a question that I think one of our young audiences wanted to ask was that what could be the main reasons behind a child with autism? What could be the reasons behind it? I mean, parents are usually very, they are very considerate about what could have been the reason behind.
Yeah.
So I would want you to elaborate a few points on that.
Okay. So a few points for why the child might have autism. Why? Where is it coming from? Like, see, for a physical disability, for a physical thing, we know we have a, if the child is not able to put their back spinal cord up, they're not able to walk. We know we have a difficulty in spinal cord, right? Or
Right.
we might have a difficulty in leg. We get an X-ray, we get what the difficulty is coming from. Like
Mm-hmm.
you have different tests, blood tests, X-rays, MRIs. You know this is the root cause. You have a
Mm-hmm.
difficulty here. This is the bone broken. This is the joint broken, for example, and we can work upon that.
Right.
Now, when it comes to mental health, okay, we know physical health is very different and mental health is very different.
Mm-hmm.
Okay, when we talk about mental health disorders, when we talk about autism in very specific today, okay, when we generally do that, we do not have a very specific reason. We are doing various studies, we have various researches coming up. Where is this autism coming from? Why the child is not able to do things in their thing? But if you tell them that, like, for example, when we say the Down syndrome happens, that is because of a chromosome that we saw in different chromosome 22 that we can see in different things. They have certain facial expressions, like their nose
Right.
is little, you know, towards in, their face is a little flat. That is something we can recognize. But for autism, we do not have certain specific things like that. Certain times it can be genetic, it can be having a family having it, a series of
Mm-hmm.
like my grandparents having it or my paternal or maternal
Right.
having it. And if I am pregnant right now, and if my child might have it in future, we don't know where is it coming. These
Right.
are
Right.
different
Right.
genes and combinations we can see. Why is it happening? Is it happening due to hereditary
Right.
factors in the family? Is it genetic in family? These are certain things. But the
Mm-hmm.
other things, the core reason, it's still not found out there. It's still not out there in, like,
Some of them
textbook.
say it's because of the physical environment or the
No,
diet that the mother or the father consumes.
again, these are not anything. These are myths about it. These are certain things that we say. If I can just, okay, if I say eat certain things when you're pregnant, would that help
Mm-hmm.
you?
Not at
Every
all.
mother
Not at
has
all.
different diets. Every mother is on different medication. Every mother some might have, like health issues. Some might have multivitamins. Some might
Mm-hmm.
not need any medicines at all.
Right.
Right? Some
Right.
have
Right. Right.
hormone imbalance. Some might like there are different complications in pregnancy. Right? So every mother is taking
Indeed.
different medication. Similarly, there's not because of any specific diet, specific food factors. This is because you ate fish, because you ate mutton, because you ate apples. Certain parents come up and they're like, okay, I must have like if I like for example I would just say tell a mother who came in and then you were like, this happened because I had a lot of berries when I was pregnant, and I was just like, okay. Number one, that does not happen because of berries or anything. It's just
Right.
that you had, because you had a lot of cravings for it. You had certain food items, right?
Right.
But there's certain things like, for example, harming the baby, being on drugs, being on other, alcohol. those kind of medications or those kind of different things that can lead to baby's mental health, that can impact on baby's physical health for sure. Not any
Mm-hmm.
normal food patterns, not like any other sensory diet. So whatever information we have on Google, whatever information we have on in textbooks that relates to diet, that relates to things. So there's
Mm-hmm.
no concrete conclusion to that. Even today, I cannot can confidently come up and tell you that autism happens because of these ABC reasons or XYZ reasons.
Right,
I
right, right.
cannot, because we are not on a stage in our professional term right now that we know any kind of reason that why is it happening. What are the very
Right.
specific domains that is it happening? We know it's a developmental disability. We know the developmental milestones are not achieved at a certain thing, but the reason of why they're not achieved at a certain pace, or why they are not achieving, or why different two individuals, one is having a sensory issue, one is having just a verbal communication. See, I told you, two individuals, two different symptoms, again falling under autism. We don't know why
Mm-hmm.
that is happening either.
Right, right,
So
right.
the core reason, if anyone asks about mental health right now, give me a specific reason why autism is happening. A lot of research are getting done. We are still working towards them to understand why is it happening. But what exactly the root cause is, we won't be able to define it at the moment.
Right, right, right. Thank you so much, Akriti. I think it was a really insightful conversation, and I'm pretty sure our audiences thoroughly enjoyed the chat. Is there any message you would like to give to our parents?
I would just say, just be happy with children. Whatever you have, they are yours. Just enjoy with them, live with them. You know, every child is as special, be it autistic, be it normal, be it with intellectual difficulty, as special as they can be, right? Not even when we say for the young adults, right? When we say that even when we are there, our parents are proud
Mm-hmm.
of us in our different domains, right? One might be
Right,
able to, for example, I'm a psychologist, one is a doctor, one is an engineer, right? Today I cannot be like, I am not personally good in maths, I cannot do something, some very calculative information efficient,
right, right,
right? So somewhere or the other, just be proud of the child, what they achieve in their own terms. Be
right,
happy with the child, and do not say that our children cannot do anything. They can and they will, with the right guidance. If you
right.
provide them the right guidance, they will be able to achieve what they can achieve.
Of course, it is always said that there's nothing that the child cannot understand. There's always a flaw in the lesson plan. Once you plan things
Exactly.
as per the child needs, I mean, you can get wonders done. Of course,
Exactly.
I think that was pretty inclusive of you, and we thoroughly enjoyed the chat. And thank you so much for your time, Akriti. We really appreciate that,
Same here. Nice talking
and
to
we
you.
look forward for more collaborations with the Mind Veda.
Yes, we'll be here, happy to help, and always there for people, and
All
always there for
right.
mental health professionals.
Thank you so much, Akriti. Thank
Thank
you.
you. Take care. Have a nice day.
Bye.